All right. Welcome back to the wake up call as promised. I know this morning we touched on a very a touchy issue out at AIA concerning COVID 19. And I did say this morning that we are going to be talking about going back to basics a little bit concerning COVID 19, testing, quarantining, because the number of active cases are going up each and every single day. And from looking and listening, we're realizing that people have the same questions over and over and over. So this morning, we're going to address those questions, all right? So we have with us, all right, unmute for me, Shanika. All right, okay, lovely. We have this morning Miss Shanika John. She is the Health Promotions Officer within the Ministry of Health, Wellness and the Environment. And we also have Mr. Elliott Samuel, who is the Chief of Laboratory Services, also at the Ministry of Health, Wellness and the Environment. Okay, so turn down your phone volume for me, please, or your laptop volume. Just turn it down, all right? And unmute. Okay? So good morning. Let's do a quick check. Good morning.
Good morning, everybody.
Good morning. Good morning. Sorry about that feedback. I actually thought it was on your end.
Okay. That's all right. That's all right. You know how things go sometimes. The good thing is we were able to fix it. All right.
Yes.
All right, lovely. And that should be the mission this morning, to fix some of the problems that we are experiencing in terms of COVID 19 and going back to basics a little bit more. All right. So I'm not sure if we should start with symptoms of COVID 19, like really going far back to basics. I mean, these are things that people should know and should be aware of by now. We're almost 2 years into this, but why not? Why not? So maybe we should touch on the symptoms first. All right.
Elliott, you want to start there?
There's a bit of shyness this morning.
Right. So good morning, everybody.
All right.
In terms of the signs and symptoms of COVID-19 disease, it's really a respiratory illness. So I think in a lot of cases, persons will present with a fever, a high fever. You would have like loss of taste, loss of smell. There's itching of the throat, itching of the back of the throat. There tend to be some aches and pains as well, myalgia, arthralgia, generalized body weakness, but it's more or less flu-like symptoms that comes on 3 to 5 days after you've been exposed from the infectious agent.
You said 3 to 5 days. It's always been 3 to 5 days, or?
Well, one of the things that we like to tell people about is what is called the incubation period, and I tend to. I mean, it's given me an opportunity to jump quickly into vaccination here, but when you pick up that infectious load, it's not enough to get you sick. So one of the things that the virus does is to sit in your system, hijack your cells basically, and just use your cellular machineries to make more copies of itself. So the 2000, just about, well, however much virus you pick up when you pick up that infectious load multiply to millions in a matter of days, and then there's an army that is enough to elicit an attack on your immune system. At that point, your immune system is caught off guard, and there's very little it can do to respond at that particular moment in time. That's really how it is for the unvaccinated individuals. For the vaccinated individuals, they would have had the opportunity to prep their immune system, so the immune system is able to recognize the virus on entry. So there is a quicker response for the person who is vaccinated, and you sort of avoid that incubation period. It doesn't say that vaccinated people don't get COVID-19 disease. We have seen where there's a breakthrough population, about 3% of the persons who are infected are in fact persons who are vaccinated. But when we say that the vaccinated individuals tend to have a milder reaction that doesn't result in hospitalization and death, the scientific evidence supports that once you are vaccinated and you have prepped your immune system responds quickly, so you don't move into that severe disease in about 97% of the cases. But there are still persons who would have succumbed to COVID-19 even if you're vaccinated.
All right. So I like how you highlighted the differences. A little feedback there. All right. So I like how you highlighted the differences between the body's response being vaccinated versus unvaccinated. Does that mean that as a person who is vaccinated, I should look out or I should be on a higher guard? What does that mean?
Well, vaccinated persons are not immune to COVID-19, and that is one of the myths and misconceptions that is out there. I mean, very often when we speak to focus groups and we ask what are some of the reasons why you haven't had a vaccine, people will hit you with things like, "Oh, if I get vaccine, I still get COVID-19," and we have said that from the get-go, that vaccination is not an antidote and it's not a therapeutic agent. So, yes, if you get vaccinated, you're still exposed and you will catch the virus if you leave yourself unprotected. And that's the reason why the Ministry of Health has always maintained that even if you are vaccinated, then you still should wear a mask and you still should hand sanitize and you still should observe the protocol that is there as a barrier method and preventative method, so that you don't unduly expose yourself to COVID-19 disease. We still have to do it until we have successfully achieved herd immunity, and we're still a long way off from that.
And herd immunity, what figure are we looking for?
Well, we're looking at about 70 to 75% of the eligible population to get vaccinated.
And the eligible population, right? Still got a little bit of feedback there. I don't know if somebody should
From me
mute.
still? Okay,
Uh,
let me
sometimes
turn my
it's,
speakers down.
yeah, or
Mm.
off. All right. Okay. Wonderful. That's much better now. So in terms of herd immunity, and you said the eligible population, the thing that has changed though is that Pfizer is now able to be given to younger persons. So how does that affect the figure for, or does it affect the figure for herd immunity? Now that more people, now that a set of persons who can be vaccinated is larger, does it affect it, or did it affect it?
Shanika, you want to jump in there?
The percentage and the population there is actually going to be captured. So before, we weren't really focusing on those persons under the age of 18. And now with the introduction of the Pfizer, we can definitely group our that particular age group, which is mostly within our school age students, within that category. With other countries, they do have priority groups that they would establish in terms of who would have first access and granted first availability of the COVID-19 vaccine. But in St. Vincent and the Grenadines, all of the different groups across the different sectors are eligible to receive the vaccine once they're willing and available to take it. So yes, it will definitely give us some additional coverage within that age group. And so we're making it available to those persons.
Okay. All right. Wonderful. Now let's move on to testing for a bit. All right. A
Okay.
number of persons have been asking pretty much the same questions over and over. Now, we might have been exposed or exposed ourselves to somebody who we learned later on has COVID 19. From the point of being told that information, what should somebody do?
So within this specific context of being told that you were exposed to somebody who tested positive for COVID-19, so I'm going to use example. So let's say we have Shirley, who tested positive yesterday, and Shirley then calls you, Crystal, and says, Crystal, I tested positive for COVID-19 yesterday. I'm just letting you know. From your individual standpoint, you then need to ask yourself, when was your last interaction with Shirley? And then you may remember that on Saturday you were with Shirley. You guys went to have some drinks, and then you moved to home by you where you were chilling and you were just there for a prolonged period of time. So what we want you to do to first identify if you are a close contact of Shirley. And a close contact is somebody who has been exposed or interacting with the individual for more than 15 minutes without a mask, ideally. So once you've had that sort of exposure to the positive contact, more than 15 minutes without your mask, we want you to start counting from the last day of exposure. So Shirley tested positive yesterday, but you are in interaction with her on Saturday. So you start counting from Saturday. So you say Saturday, Sunday, Monday, Tuesday, Wednesday, and then you get tested on day 6. So that would give you
Okay.
sufficient time in the event that you do test positive for the virus. What we are also advising persons as well is that during that waiting time, which is your quarantine time, we're going to ask you that if you do start developing symptoms, that you should go to the flu clinic. And that's because with the Delta variant that we do have local cases in St. Vincent, the Delta turnaround time for antibodies is going to be about a shorter time frame, about 3 days. So whereas with the normal coronavirus strain, it will take about 5 days or so for you to start having symptoms, even if it's mild symptoms. With Delta, it will take about 3 days. So timing is important. So what we don't want you doing, Crystal, is that Shirley calls you yesterday, lets you know that she's been tested positive. The last time you saw Shirley was yesterday when you had lunch with her, to immediately then today go and get tested. Because if you do go and get tested today, you're tested, but it's not from Shirley's exposure. Your exposure for that particular test would be from prior to Shirley's interaction.
Oh,
You
so
do get
really
a
and truly, people worry, but they still have
right.
to worry.
Right. So if you do get a negative test result, it won't be because you were exposed to Shirley yesterday, but it would be because you were probably exposed to something else 5 days ago that you were not aware of. A positive result, that
Positive
is.
test result. I just wanted to
Right.
correct that.
Thank you. Thank you. A positive result, that is. If you do get a negative, it's also an indication of your exposure prior to Shirley again. However, 5 days or 3 days later, that would really give us if Shirley was your main exposure. And that's how our team work with contact tracing. So a lot of businesses, a lot of individual, I understand the anxiety of wanting to know, and quarantine in itself is must be a very horrible thing to go through. But at the same time, learning how to understand how the virus itself works and knowing when it's important to testing could also help in terms of the detection and containment. Because imagine, Crystal, if you go get tested today, for surely you get a negative and you walk free, oh, I'm negative, surely I got back my results. And then on Friday, you start experiencing symptoms. You may brush it off and think it's a cold or a flu because why? You got a negative test result. On Saturday, you may not be doing so well and you go to A&E. And when you go to A&E, they say, well, you're tested positive for COVID-19. And some persons will say, oh, but how come I tested positive before? But it's just that you tested too soon from the exposure of interest.
Would the persons at the various flu clinics and any health facility, would they be able to like guide you, or do they ask you when was the last time you were in contact with somebody, and maybe you tell them it was yesterday? Would they tell you, okay, you need to go back home and wait till the 5 days and then come back?
Yes, they would, and they should. And even if they don't advise you in that, which I've never heard of instances where they haven't advised in terms of the calculation, but I think some persons are not aware of when they were exposed or when was their last date of interaction with the individual. So Shirley calls you and said she's positive, but for some reason you can't remember when was the last time you was with Shirley. But the fact that Shirley called you, you immediately, your reaction to it is, let me go and get tested. So when you
Right.
go to the flu clinic and they ask you, you need to be able to provide them with that information to guide their specific action. And if you're not able to do that, they may still advise you to quarantine for some time if you're not symptomatic, that is. Symptomatic means that if you're not having a cold, if you're not having a fever, if you're not having a runny nose.
Okay, so Shirley might have been in contact with me. I'm living at home with my family. The first thing I should do when Shirley calls me is self quarantine, correct? For that
Correct.
5 day period. On the sixth day, get my PCR test done, not the rapid test, the PCR, right?
Mhm.
So get that test done. So while I'm there at home quarantining, right? Or before Shirley calls me, I was in contact with several other people. Do these other people who are around me, let's say my mother, my brother, and whosoever else, should they also be on the guard, or should I tell them as well? Should they also quarantine? Should they start to worry?
In your immediate household, they should be on their guard because you're in
Mhm.
quarantine. And quarantine simply means that you have the potential of testing positive. Remember, we're also testing from the exposure of interest. So if you quarantine and you wait, you're quote unquote classified in that particular instance first as a primary contact. Your parents and other persons may then be classified as a secondary contact to Shirley's exposure. They may only become primary contact to you if you test positive.
Okay, so they should just be on the guard.
Elliot, you want to
Yeah,
help?
I'm pretty sure this is what a lot of people are experiencing right now. They heard somebody who get from somebody who get from somebody else, and they were next to this
Right.
somebody else,
Yes.
and everybody is like going really crazy. That perhaps might be the reason why you guys have to be testing so much. Yeah.
Yes, it's
So
something.
Elliot, jump
Sometimes
in there.
we test in circles because people are not very truthful, Crystal, with the information that they give. So, Crystal knows that she tested positive yesterday. Crystal knows that she was with Elliott, but Crystal will not give Elliott information to us. And so the cycle continues in that particular way, unknown to the health team. And it's not until maybe later Elliott may come into contact or start having symptoms that Elliott tests positive. And you're trying to figure out, Elliott, what was your last contact? But Elliott will not mention Crystal for whatever reason.
All right. So Elliot, jump in there now. Not
I
with
think
anything else, but
just to add that, I mean, we were talking about contacts of a contact of a contact, and when you look at how contact tracing is set up, you are contact trace if you are somebody who have gotten exposed to an individual who is tested positive. We call it a laboratory confirmed case of COVID-19, and that exposure has to have been on mass for at least 10 to 15 minutes. So sometimes people get a little antsy because you're hearing that Elliott was positive and Shanika was exposed to Elliott and I was exposed to Shanika, but it doesn't say that because Elliott was positive and he may have encountered somebody else that person is positive. So you don't have to jump to run to have a test done. You really need to confirm that the person who was exposed was actually positive and to wait, because I've mentioned what is called the incubation period, and um, that comes into play. So even if you were exposed and the person you were exposed to was positive, you still have to wait the incubation period, because you could be giving yourself a false sense of security by going too early and getting tested and getting a negative test and think, well, all is well and fine with you.
uh-huh.
And
From
another thing
go
to come in there, Crystal, is that we want people to generally be on their guard. You shouldn't be on your guard only when somebody says to you, I've been tested positive for COVID-19. I'm just informing you. You're supposed to move as if generally in your setting at home, on the job, when you go through town, where you're taking a bus, as if everybody around you really have COVID. Because you really just don't know. And when I
It's
say that,
everybody.
I'm not talking about the stigma and the discrimination, but I'm talking about the precautionary measures that
okay.
you need
The
to take.
basic things, the things that we were told from
Yes, yes.
1902, right?
It's
Way
actually called
mass.
universal precaution, and you treat
Universal.
everybody as
Thank you,
potentially
Elliot.
infectious.
Thank
All right.
you.
Say that again,
Crystal, you
Elliot.
mentioned you mentioned something a while ago, and I really want to use the opportunity to clarify something here. You mentioned PCR testing, and you sort of hit the rapid testing a little bit hard in terms of if you're going to be tested as a contact, you really need to have a PCR test done.
Okay,
Now,
yeah, that was one of the questions, right?
when we
Rapid
said
versus yeah.
right. When we say rapid, I think a lot of people are of the opinion that a rapid test is not a good enough test to diagnose PCR, to diagnose COVID-19 disease. Now, we
Uh-huh.
have different level of testing, and what we have been advising the public from day one is if you think you are exposed, do not use a rapid antibody test to know if you are COVID-19 positive or not, because the rapid antibody test, and people tend to say that, oh, it only tells me if I have been exposed, but the rapid antibody test, there's really a reason why we don't use it as a diagnostic test for COVID-19. The antibodies that you get when you are exposed to COVID-19 takes about nine days onward before those antibodies are produced. So let's just say that I'm exposed to somebody who's positive and I'm doing a rapid antibody test to know if I too have COVID-19. I may be setting up myself again for a rude awakening by doing an antibody test, because it takes a long time for those antibodies to be produced. Now, the rapid antigen test, it goes directly after the viral agent, just like a PCR test. The PCR goes after the genetic construct of the virus. The antigen test goes directly for the virus itself, and we are looking for antigenic determinant on the virus. So an antigen test do offer you a high degree of sensitivity and specificity when you do it as a diagnostic test. And we have been doing what is called in-country correlation and validation, and the antigen tests have been performing. We have seen in the fields where persons who are antigen positive, we are getting good correlation with those antigen tests versus PCRs. And we'll get into the strategy of testing a little later on. But I just wanted to explain now that if you go to a clinic and the nurses do an antigen test on you, an antigen test is just as good. It may not be as specific and sensitive as a PCR, but it's just as good. It's going to pick up if you are positive at that space and time. It's going to pick it up. There's
Okay,
a
and
there's a there's a high degree of of chance that you will get an antigen positive if you are exposed and you are positive at that time.
Okay, so how long does it take for a patient to get back results from that antigen test?
The antigen test is given, the turnaround time is 15 minutes. If you're at the clinic, you are tested and you're given back that result in 15 minutes.
15 minutes.
Yes.
You know something that you guys mentioned before that I don't know if it flew over my head a couple of times or what, but you mentioned being exposed to a positive person 10 to 15 minutes unmasked. That I think is really important and people should pay attention to that, because not so that you could drop the ball because, oh, I was wearing a mask, I was keeping my distance or whatever, but a lot of people just automatically thought, yes, we were told that the mask would help and would assist with reducing the chances of contracting COVID-19. But that 10 to 15 minute window, I think that has not been highlighted as much as before. So thank you for that. All right. So it is now 7 minutes onto the 9 o'clock hour. All right. We have not ours, I was going to say in studio. We have joining us this morning Mr. Elliott Samuel, who's the Chief of Laboratory Services at the MCMH. We also have Miss Shanika John. She's the Health Promotions Officer within the Ministry of Health, Wellness, and the Environment. All right. If you have your questions, you can go ahead and send them to our WhatsApp at 430-1043, or you can send them on Facebook. We are live right about now at Extreme 104 SVG. In terms of testing, right? I understand, and just for clarification's sake, please, I understand that if you are going based on contact tracing, you don't have to pay. Versus if you're going, you're ill and you experiencing flu-like symptoms, you go to the flu clinic, you say, I want to get tested for COVID-19 to do that PCR test. Just speak about the costs for a bit there.
Okay, so first of all, COVID-19 is a public health disease with the capacity for international spread. And even if it didn't have the capacity for international spread, once it fall under the ambit of public health and you are requesting the test for public health purposes, you are coming in as a symptomatic person, or you are the contact of a person who have been diagnosed of having COVID-19 disease, then it do not attract a cost. And for obvious reasons, it is within the country's interest to identify these cases and bring them into care, and to try to lower the burden of illness of the incidence of disease. If you are requesting a COVID-19 test for job purposes, you are doing it for travel purposes, then it's not a public health reason. So then it do attract a cost. So for persons who are contact cases, we call them public health cases, they don't pay to have that test done. And you shouldn't. If you go to a healthcare facility and you're told that you have to pay, just know that you do not have to pay for a test if you're a contact or if you're symptomatic. If your job requires you to have a COVID-19 test done, whether it's an antigen test or a PCR test, then it's going to attract a cost, because you're coming as an apparently healthy person to get that test done, and you're not a public health case. Now, for the antigen test, we offer the antigen test at $26 EC, and for the PCR test, we do it at 56 EC for the nationals, and 103, I think, 106. I think it's 106. Don't quote me, but it's somewhere in that ballpark. $106.
Almost double the price.
Yeah, for a non-national.
Okay.
And just to note that there is a huge subvention as it relates to the cost of a PCR test in St. Vincent and the Grenadines. I think it has been said that health is a merit good, and it's really the responsibility of the Ministry of Health and government to offer the service to people. And the government have been doing an excellent job in terms of not transferring the real cost onto the public.
All right. In the interest of public health. Shanika, you wanted to add something to that? Oh, I just saw the shifting there. Okay. So the final question on testing, right? Where do you pay? Because some people are being told you have to go to Kingstown to pay and then take your receipt. Are all the flu clinics or all the clinics across SVG, are you able to get that antigen and PCR testing done? Are you able to pay at every single clinic? Some guidance on that one.
Well, I think you can pay into any revenue office for the government. Just keep your receipt. Just when you're making that payment, you're instructing them that you're paying to have an antigen test for COVID-19 or a PCR test for COVID-19. and that receipt is then presented when you are collecting your results. I think for the public health cases which you don't pay for, you're given those results on site if you get an antigen test done. And if it's a PCR test, the result is then sent back. We have an organized system where the result is sent back to the team leader in the district where you would have had your test done. So you just communicate with the clinic, or they will communicate with you in terms of updating you on what your test result is. For the persons who are doing the test for job purposes or for travel, those results are collected at the main laboratory in the hospital, which is the MCMH lab. And just to say that we are open 24 hours, I know people get a little antsy when it's approaching 4 o'clock and they have not received a result yet, and they're thinking that the lab is going to close on me. But the lab is actually opened 24 hours a day. We have 3 runs that we do. We have three runs. We have 3 shifts that we offer at the molecular lab, and the results are coming off of those engines at any time of the day. And whenever we get them, they're there for distribution. So sometimes people are given a call at 2, 3 o'clock in the morning to say, hey, your results are ready. And if you can pass by and collect it now. And we do have people who come to us at that time in the morning to collect the results.
Don't call me at 3 o'clock in the morning to give me no COVID-19 results right now.
Some people ask that we do. Some people have an early morning flight. There's a little
that.
Yeah, there's a little narrow gap between when they brought the sample and us getting it ready for them. So we do have to give them a buzz sometime at a later hour to say that your test is ready, your results are ready, and you can drop by, or on your way to the airport you can pass and collect it.
Okay. I know I said that. Okay, Shanika, you want to add to that?
So I want to add to in terms of the exit screening for people who are leaving the country and you may require a PCR test. We do have the online platform. I know some persons have been asking us for it for a while. Our IT department we were able to launch that last week. So it's on our Facebook page, SVG Health. It's actually pinned to the top where you could actually fill out the application online and you can go through that process. For those persons who are doing exit screening, if you do go to pay at Stewart's office, at any of our polyclinics where there's a clerk that they could receive the funds, they would ask you for that appointment sheet, just to say that you do have an appointment, because we do have persons who may try to, go around the system a bit. So the exit screening requirement still stands. You have to do an application form. It's now online based. You then have to wait for your approval in terms of where you would be doing it. You go to the steward's office or to the revenue office that's taking you pay, you hold your receipt, and then you go back to the lab and pick up your results. So I wanted to just make that clear so that persons don't try to go ahead and pay without going through the application process as well.
All right. Okay, so we're going to take a quick break on that one. When we come back, a lot of people, I've been hearing as well that some persons have been waiting for some time to receive a call to get their results. So maybe we can touch on that. We have a couple questions lined up from listeners, including vaccinated events and what is going on at the AIA. But when we come back, we're going to take a quick break right about now. All right. See you then. I'm going to just do this right